Hi, in this video, we will learn about how to feed a child after they are 6 months of age and how to monitor the growth of a child. So, we all know that till 6 months of age, the mother should give exclusive breastfeed, and afterwards, the child should be on semi solid food and also on continued breastfeeding. So, exclusive breastfeeding should be done up to 6 months of age, completed age, and afterwards, breastfeed can be continued for 2 years and beyond, along with complementary feeding, that is, additional feeding. And the growth of the child, that means the weight, head circumference, length of the child, is monitored by the child doctor. The baby, once it is born, is also screened for any birth defect, any problem of the eyes, any problems with the heart using pulse oximeter, any problems of hearing using hearing screening tests like autoacoustic emission, and any problems of metabolic diseases. So, feeding, playing, and communicating with the children is necessary for their growth and development. In the first 6 months, they should be fed exclusively with breastfeeding, early and exclusive breastfeeding. Your baby is very small and tender with small stomach and only needs mother's breast milk. Sometimes your baby cries because he or she wants to be held close. Keep your baby in close contact with your skin. While breastfeeding, smile, talk, and look into your baby's eyes. But don't shake the baby while you are feeding. Then put your baby to your breast immediately after birth within half an hour. This helps in establishing breastfeeding and bonding. Breast milk provides all the nutrients and contains sufficient water. Do not give your baby anything else to eat or drink, not even honey or water in the first 6 months. Even in your baby's illness, continue to breastfeed till 6 months. And after 6 months, your baby requires small, frequent meals along with breast milk and other liquids during illness. So, the mother's first yellow milk, which is called colostrum, is very important. You should not discard colostrum. The first milk has to be given. It contains a lot of immunoglobulins, protects the baby against infection. And in the first 6 months, the baby should be fed on demand, both during day as well as night. So frequent feeding increases breast milk flow. So even at the night, the mother has to feed at least 4 to 5 times, especially in the first 3 months. And it is in the night that the hormone which is responsible for milk production, prolactin hormone, is secreted more in the mother's body. And breastfeeding improves intelligence. So it's very important that the baby gets breast milk, especially in the first 2 to 3 years, and continue as long as possible. If you have any problem in breastfeeding, you can contact your child doctor or healthcare worker. So now coming to feeding a child after 6 months of age. So after 6 months of age, breastfeeding has to continue. Along with breastfeeding, the child is given water to drink because once the food is started, the stool becomes harder. So it is important that the child takes more water. And the child's body weight is mostly made up of water. Up to 70% of child's body weight is made up of water. And the child requires around 700 100 ml per kilo of water per day, which the child usually gets from the mother's breast milk. Apart from that, you can add 100 to 200 or more ml of water by glass as per the child's demand. So the child should not be fed with bottle because bottle feeding is known to cause more chance of infection, especially in tropical countries. Now coming to the fat requirement. The child's brain is mostly made up of fat. Up to 60% of the brain is fat. Now, first 8 years, the brain reaches 90% of adult volume, and the brain therefore requires very high, large amount of fat in the diet. So, up to 30 grams of butter the child receives from the breast milk itself. Similarly, you can also add unsalted butter in the food of the baby. Carbohydrate is very important for the child because the carbohydrate-rich food will stimulate the insulin secretion in the child's body. Now, the insulin is an anabolic hormone. It is a growth hormone, and it helps in the weight gain of the child. So, the keto diet people use to have to lose the weight. It is mainly carbohydrate deficient diet. So, if you want to lose weight, you can use keto diet, but it is not recommended. But if your child has to gain weight, definitely the child has to get carbohydrate. Now, the mix soft solid food or powdered banana or ragi powder with water or coconut milk or cow's milk to make it semi-solid. Now, there is a controversy regarding cow's milk. Usually, it is advised after 1 year, but recent research has shown that if you introduce cow's milk within 1 hour, within 1 year of life, then the chances of allergy to cow's milk is less. So there is no problem in adding cow's milk for mixing the food and making it semi-solid, especially if there is no allergy in the family to cow's milk. Now use variety of nutrients because different nutrients have different uh, micronutrients. And so you use the variety of food. So you can use beetroot, you can use carrot, you can use a lot of other food items, fruits, green leafy vegetables, then even egg. And different types of food will give different nutrients. For example, beetroot is rich in iron, and iron is very important for hemoglobin synthesis and oxygen carrying capacity. Now, allow the baby to copy the parent while feeding. So first, let the parent eat and let the baby watch the parent while eating so that the baby gets the desire to have the food. Otherwise, instead of that, if you feed the baby first, the baby may avoid feeding. And give food feeding at least 3 to 5 times a day. So starting at around 7 a.m., then 11 a.m., then 1 p.m., then 4 p.m., then 7 p.m. So if the baby is mostly on breastfeed, a 3 times feeding will be sufficient. But if the baby is not on breastfeed, mostly on formula feed, then you can feed the baby with 5 times. But after 1 year, it is better to feed the baby at least for 5 times a day. Now the baby does not have any teeth, so you will have to do the work of the baby's teeth. That means you have to crush, mash the food before make it semi-solid, make it like liquid with by mixing with water or coconut milk or cow's milk, and then use your fingers. Do not use any machines like Mbfhi to mash the food. Give fully boiled egg. Yellow of the egg can be given at 8 months, and white of the egg can be given at 10 months. So again, why fully boiled? Because a semi-boiled or half-boiled egg may contain certain harmful bacteria which can cause infection. Then you can give boiled and mashed banana and apple. However, what all foods you should avoid? You should avoid food sweeteners. Occasionally, if you give it, it's okay, but if you give it regularly, the baby may start to avoid taking food, may have recurrent infections, and may have reduced appetite, may have increased crying and abnormal behavior. So avoid frequent or regular food sweeteners. Do not give it daily or on alternate day basis or on 2 to 3 days every week. Avoid even occasional cold food items that can also lead to throat infection and reduced food intake. Avoid excessive spice and use of pepper. Even if the mother is feeding, she should avoid. It's better for her to avoid pepper. Now avoid bottle feed and pacifier because the reason is obvious. You will have more infections like pneumonia and diarrhea in tropical countries. Avoid excessive salt. You can avoid salt, or you can use very small amount, but do not use excessive salt. Then avoid honey, especially in the first year because of risk of food poisoning called botulism. Now, this is the diet that you can give for 6 months to 2 years that I've already said. You can continue breastfeeding. Then you can, on completion of 6 months, start feeding the baby with 2 to 3 tablespoons of soft, well mashed food 2 to 3 times a day. Introduce one food at a time, such as a small amount of vegetable, followed by fruits, dal, cereals. Increase the amount of feed slowly. You can give iron drops to improve the hemoglobin. And between 6 to 9 months, continue breastfeeding. Change the consistency to lumpy feed and give it 3 to 4 times a day. Give food 2 to 3 times a day with 1 to 2 snacks. And snacks means a boiled banana. Increase quantity and diversity of the food. Introduce one new food at a time, such as khichdi, dalia. Include at least 4 food groups, such as cereals, green vegetables and fruits, oil, ghee, mashed dal, fish, and hard-boiled egg, fully boiled egg. And you can give iron drops. Between 9 to 12 months, again breastfeeding continued. After 9 months, feed at least half a katori of food that requires chewing 3 to 4 times a day. After 12 months, introduce family food. Give 3/4 to 1 katori means a small bowl, and 3 to 4 times a day, along with 1 to 2 snacks. Give finely chopped food that the baby can pick up using thumb and fingers. Allow the child to eat with one hand, even if they mess up. Vitamin A is also available during this time to treat the vitamin A deficiency or prevent vitamin A deficiency, and iron drops. So the general tip is that you should wash your hands with soap and water. Wash the hands of the child also with soap and water before preparing food and also during the feeding of the baby. Now, if you are feeding eggs, then it should be hard boiled. Then usually thoroughly washed, rinsed raw fruit and vegetables under running water before cooking. Cook thoroughly and use safe water. Discard all leftovers on children's plate. Do not save them for later. You can give iodized salt to prevent iodine deficiency and also iron drops. Now, we monitor the growth of the child by measuring the weight, the length, and the head circumference of the child, even mid upper arm circumference. Then we plot on the growth chart. In the growth chart, there is green zone, yellow zone, and red zone. And red zone means malnutrition. Now, it's usually done by healthcare professional, a worker, and it is done frequently, depending on the baby's. It's done as per the baby's age, like 6 months, 1 year, and during time of vaccination also. While the baby is getting vaccine, you measure the baby's weight, head circumference, and length. Now, up to 6 months, you have to give explosive breastfeeding, which is best for the baby's brain as well. Now, feeding advice is given. Then there may be some initial problems which you have to sort out as a doctor or a nurse or healthcare worker, or as a relative also you can advise to visit the doctor. Then you have to do the semi-solid to solid food transformation. So while monitoring the growth, you have to see that the baby is gaining weight. Okay. So initial first 14 days, the babies usually lose weight up to 10% by term babies, and up to 15% of birth weight is lost by preterm baby. After the 5th day, the baby starts to gain at least around 20 grams a day for both preterm and term baby, around 20 grams. And the weight is gained by 20 grams every day in the first 3 months. And in the first 3 months, the head circumference usually grows by around 1 centimeter, and the length usually increases by 1 centimeter. Generally, the birth weight is doubled by around 4 to 5 months, and the birth weight becomes 3 times by around 9 to 1 year of age. And the serial plotting of the weight, length, head circumference has to be done as per the WHO growth chart. Now, this is the growth chart which is available in our health centers. and it has a green zone, yellow zone, and a red zone. And a red zone is an underweight baby. A green zone, a yellow zone is a moderately underweight, and a green zone means normal weight. So similarly, we have a different chart for the boys as well as girls. This is the WHO growth chart. It is available till 5 years, and this is a length for age. That is for monitoring the length of the baby. For boys and girls, they are separate. And then there is a growth chart, WHO growth chart for monitoring the head circumference for both boys and girls. Now for preterm babies, we use a certain chart called the modified Fenton chart till 40 weeks. And after 40 weeks, we use the WHO chart. And the weight gain is as per the 20 grams per day. Usually the baby gains weight at around 20 grams, at the rate of 20 grams per day. Human milk fortifier may be added to express breast milk, especially if the weight is less than 1.5 kilo. Birth weight is less than 1.5 kilo. Then kangaroo mother care, which is skin to skin care, and development supportive care is used in the preterm baby. This is the modified Fenton chart, which is again different for girls as well as boys. Here you have provision for monitoring the weight of the child, the head circumference, and the length of the child till 50 weeks of gestation. So you can monitor till 50 weeks. And after 50 weeks, you can use the WHO chart. So with that, I hope you understood the feeding advice. After 6 months, you have to continue breastfeeding even till 2 years and even beyond. And you can start semi-solid food, and by around 1 year, you can give solid food as well. And you can monitor the growth, that means the weight, head circumference, and the length, and you can plot the growth of the child serially over the growth chart. Thank you.